everybody, Dr. P here. Thank you so much for joining us on my channel. Listen, today we're talking about, do hormone blockers cause infertility? Today we are talking about hormone blockers and what they are. We will review exactly how they work. We'll talk about the impact of these hormone blockers on fertility, and we'll end the video by talking about a few tips that I have for you to help maintain fertility if you are using hormone blockers. So let's dive on in today. Let's dive on in today. So you're here because you may be considering hormone blocking, or you're currently taking medications to block hormones, and so you have concerns about fertility, and these concerns are legitimate concerns. I'm glad that you're here. We're going to have this conversation today, but I do want you to have these conversations with the person prescribing or planning to prescribe these medications as well. When we think of hormone blocking, we're talking about medications that are being used to slow down or stop the natural processes that your bodies undergo during the reproductive years, particularly, wherein these hormones are being released to help your body to function and to be, but also to emphasize or to allow your fertility to be the way it should be. And so there are times that we want hormone blocking. For instance, if you have endometriosis, a condition where we know that hormones impact your body, very much so, a condition wherein you have a ton of pain throughout your cycle, especially at the time of your menstrual cycle. And we know that hormones play such a huge part with this. And if you're searching for a way to not have as much pain, sometimes hormone blocking medications may be a consideration. If we're having problems where we have an excessive amount of estrogens and progesterones, we may want to use hormone blocking medication. Maybe you have a child that is undergoing puberty way too early, and we're thinking to delay this process a few years. We may talk about hormone blocking medications. Regardless of these scenarios, there are absolutely risks that may be involved. But let's talk a little bit more about what these hormones and these medications may look like. Most hormone blocking medications are often what we call the gonadotropin releasing hormone medications. These are medicines that are meant to specifically block the activity of our hormones in our system. They may also reduce the production of hormones in our bodies as well. In the state of being a young child who has not been living with these hormones and their activity in our system, because young children do not until the point of puberty. So if your child is undergoing puberty at an early age, blocking these hormones will have less of an effect compared to an adult who has been functioning with hormones in their system for many, many years, and now we are blocking the effect of those hormones. And the differences there are ones to be aware of and be mindful of, because for a young child, the risks would be much less in blocking these hormones earlier on versus an adult. And the reason is, as an adult, a reproductive age adult, we expect to go through these transitions in life, going from not having a lot of sex hormones to having our sex hormones, and for our fertility to be present until menopause, when we do not need fertility anymore and the hormones go down naturally. This transition is normal. And so for an adult, when you're in your reproductive years, when we stop suddenly the hormones that create your fertility, we will experience the same changes that will occur when you undergo menopause. So what does that look like? Well, most people may have hot flashes, for instance, or night sweats. You may have a decrease in your bone density. You may be at risk for cardiovascular changes because your hormones like estrogens typically are very protective when it comes to your heart, your cardiovascular system, as well as all of your other organs. And so blocking your hormones suddenly with hormone blocking medications, you will and more likely experience the changes of menopause at that time. Now, in general, whenever you use these medications, we often will give them for a short period of time. The recommendation really truly is the lowest amount of the medicines for the shortest period of time for you to have the symptom relief that you're looking for. And so, if you take these medications accordingly, the symptoms and the side effects that you will experience will be for a short period of time. There are also other medications that we can give you to help to mitigate the changes that can happen because of blocking your hormones. And so, in general, your doctors and your providers are quite aware of these symptoms, but they really should talk to you about what they may look like for you and how we can help to reduce those symptoms from happening. In general, if you use hormone blocking medications for a short period of time and the lowest dose that can be successful for you, there will not be long-term effects. Research has shown that even if you were to have a decrease in your bone density, for instance, it is not long-lived. We know that after discontinuing the medication, the density of your bones should and oftentimes will go back to normal. And so with a child, once that medication is decreased as well, puberty will then resume because the changes of hormone blocking medications are typically temporary. So now when we consider other scenarios like transgender changes, hormone blockers can also cause changes to your body that we want to talk about. Specifically, we want to now focus in on fertility and the changes that can happen when we use hormone blockers. As I mentioned earlier, for a majority of those using hormone blockers, for a short period of time, there should not be long-term changes. During the time frame of using hormone blockers, however, you may have fertility changes or concerns, such as not ovulating well. Hormone blockers can prevent ovulation from occurring. You may have concerns about your sperm and the functioning of your sperm because of them. And so I want to mention a few research studies that will give us a better scope on what this may look like. One study found that those assigned male at birth may need to discontinue blockers and undergo male puberty to produce viable sperm. This is a process that can cause a lot of stress. Here's another research. This study indicates that the use of puberty blockers can prevent the natural maturation of gonadal tissues. What this means is that puberty blockers or hormone blockers at the time when you should undergo puberty fully, these medications may prevent the tissues of the reproductive tract from ever developing. In these cases, you could see, or there could be more long-term effects because your tissues and your organs in the reproductive tract were not able to fully mature before using these medications. And so in general, we don't recommend, or if you can wait until you're beyond those puberty years, beyond the time frame where your organs are maturing and creating their new norm, we want to wait that time frame if we can before using hormone blockers. And so if you're just like, well, I really don't want to wait, or maybe you're undergoing hormone blocking for different reasons, it's important that you have these conversations with your doctor. And some of this may also include the options to freeze your eggs prior to starting if we are concerned about potentially not having fully functioning eggs after treatment. And the same for sperm. You can store your sperm as well so that your sperm is not under the impact or being influenced by the medications that you're currently taking. Sperm and eggs can be stored for a very long period of time. And the beautiful thing about storing them is that they're stored in their current state, meaning that if your system has not had hormone blockers, for instance, in it at all, your sperm and your eggs have no influence from these medications. And so they will be stored in their current state. These are important questions and important things to talk to your doctors about, because the risks to fertility can be real depending on where you are in your life journey. Talk to your doctors, ask these questions, and become informed so that you can make the best decision for yourself. Now, if you are on hormonal journey or you're having hormone complications, I have a free gift to offer you today. I would love to send you a free copy of my Hormones Don't Lie ebook just for your use, for your learning and your understanding. For you to get that, click the link below this video and I will send it right over to you. Thank you so much for being here. Let me know what your thoughts are. Drop a comment or a question below. And listen, I wish you so much luck as you continue on your journey to hormonal happiness. Thank you so much for being here today. Take care.